Hello, my name is Heather Jackson. My PowerPoint presentation is about nursing interventions that meet the cultural needs of our patients. Also, be sure to view my partner, Valerie Brown's PowerPoint, as she will be explaining further interventions. To implement culturally competent nursing practice, the standards state we have to establish a trusting relationship with our patients. We must do this through open and sensitive communication, active listening, and respect our patients' cultural belief and practice. We have to obtain focused information about our client's presenting illness and his or her perception of the cause of that illness and the beliefs about their cultural treatment modalities. We have to conduct assessments of clients' physical, psychological, and cultural attributes and use this data to plan and prioritize the care. And lastly, we must negotiate and implement culturally congruent care and evaluate health concerns of our patients. We must be culturally sensitive as nurses. We are not all the same, and that's okay. We have many different cultures, especially here in the United States, and we have to recognize those cultures. Be careful not to stereotype, but we have to be culturally sensitive when we're taking care of our patients. Assessment. Assessment is our first intervention as a nurse in many different areas, and that includes in assessing the culturally sensitive areas. Cultural assessment involves cultural care negotiation. Leninger, who is a pioneer in the cultural care theory of nursing, defines this as those assistive, accommodating, enabling, creative provider care actions or decisions that help cultures adapt to or negotiate with others for culturally congruent, safe, and effective care for their health, well-being, to deal with illness or dying. Cultural assessments are there to enhance the delivery of patient-centered care in the midst of cultural conflict. The Kleinman explanatory model emphasizes finding out what a patient's view is about their illness in his explanatory model. He suggests using open-ended questions. What do you think has caused your problem? What are the chief problems your sickness has caused? What do you fear the most? We need to do this so you allow your patient time to explain more of their thoughts about their illness and what it's going to take to get them better. We need to allow our patients to do that. Other assessment tools that are available are the Geiger and David Heisar assessment tool. Uses cultural skill. It uses 5 components. Communication. An example would be, what are the differences in communication? Are people cry more? Are they more stoic? Are they very expressive in their gesturing? We need to consider space. How close should you be when talking to a patient? Is it okay to touch a patient of a different sex in a certain culture? Social organization. Who is the head of the family? Who makes the primary decisions? Time. How much time is observed between death and burial? These are different in different cultures, and we need to take time to find out. The environment. How much control does a person have over what is happening to them? And lastly, biological variations. What health conditions and diseases tend to be more prevalent in a patient's culture? These are things that we need to be aware of. And then we're back to Leninger and the Sunrise model, which is what she uses as her assessment tool. She uses 3 modalities. She prefers not to use the word intervention because she feels it gives the connotation of separation between the healthcare individual or nurse and the patient. So she likes to use the word modality because it implies more that you're working together to implement your care. But 3 of her modalities, the first one is preservation and maintenance. The nurse should not be judgmental and should not tell the patient that their way is wrong. You can work together to figure things out, but don't just assume because their way is not your way that it's wrong. Using cultural care accommodation or negotiation. The example I read was if an individual is using a folk remedy to treat a wound, instead of them telling them that it will not help, the nurse could ask, is it working for you? Are you getting better with this type of treatment? And last is repatterning or restructuring. The nurse could show the patient a different medicine and give them information concerning the new medicine, such it has helped her and others to heal, and explain that it will help if they use it on a regular basis and not one time. So you're showing them a better way to, in a beneficial way, to maybe where they do need to change their health patterns to have a healthier life. There are many tools, as you read in our teaching segment of these PowerPoint presentations, many different tools in cultural assessment. I just found it important to go over these again because we need to know the questions to ask. We need to know, how to allow people to discuss their differences because of their culture. We can't be afraid to ask these questions. This is the way we find out why people do what they do. Even if it's not the same as the way you think it should be done, doesn't always make it wrong. This helps us to give culturally appropriate care. This slide takes us just a little side note here. It was an article I read by Shin. It was a review of all the cultural models and assessment tools out there. She listed in comparison and contrast all of them, how they worked. It was very detailed. And she says they have done their job in raising awareness, causing us to be more aware that, of questions we need to ask, how we need to ask them, and those type of things. But her concern was that there needs to be further work to figure out the outcomes and effectiveness of these tools. Are they effective? Are they making a difference in our care to patients of different cultures? I thought it was an interesting side note regarding assessment. Okay, on to a different nursing intervention, cultural brokerage. This was a term that I was not familiar with. This was new to me. Cultural brokerage is the deliberate use of culturally competent strategies to bridge or mediate between the patient's culture and the biomedical healthcare system. I found this video on YouTube, and I thought it did a great, good way of explaining how cultural brokerage worked in Australia with Aboriginal people and the healthcare system. I I found it very helpful. I hope that you can click on the link and are able to view it. If not, copy and paste it to YouTube, because I thought it was a good video, but that's something I didn't know about. So take the time to look at it, please. A case study that I found regarding cultural brokerage was also in Australia. It involved liaisons or cultural brokers to bridge the gap between the Aboriginal people and the mental health care system. It was a pilot study that was found to be successful, and they were able to include poorly established partnerships and communication among healthcare services, poor understanding of determinants of social and emotional well-being, cultural insensitivity, and persistent perceptions of mental health stigma. They were able to do these things with initiating access to service, translators, networkers, and facilitators. And I think it's a successful pilot study thus far, and I'd like to see the results of that. I just have a question for everyone viewing these PowerPoints. Do you know of cultural brokerage or cultural assessment being used in the facility where you work? Just curious to wonder what people would say. Healthcare professionals must be aware of their own cultural biases, and they must do a cultural assessment of themselves. This will make us better cultural brokers for our patient. Here I have listed some ways to find out more about cultural diversity in nursing. Internet resources and journal articles, or journals to look up articles. These are the references I used for my PowerPoint presentation. I hope you've learned something. I know I did completing this PowerPoint presentation, and thanks for watching. Bye-bye.